Today's video is on a posterior amalgam restoration. So the first thing is you want to make sure that your operatory is open and clean and ready for your patient to come in. Then you want to make sure that you have reviewed their health history and updated anything that you need to on their chart. Before the patient enters the room, you want to make sure that you have all your equipment ready and set up to go. So you have your amalgamator, you have your Mercon products for after. You want to have your tray all set up in the proper order and having all the right equipment and all of your dental dam supplies ready to go. For an overview of your tray setup, you should have your instrument burrs, you should have your local anesthetic, your high and low speed handpieces, your Maya retainer, matrix band and wedges, your HVE, SE and triplex tips, your cotton rolls and cotton tip applicator, your varnish and liners, and your amalgam capsule, amalgam well, amalgam carrier, and Mercon products, as well as your articulating paper and paper holder and dental floss. To start off with, you will have the straight Fisher crosscut and your inverted cone. Make sure that you have your treatment record all set up, as well as the initial from the patient, and get your patient all set up and ready to go for the procedure. Inform the patient on the procedure today. Okay, so now we are going to start the procedure. So the assistant will hand the mirror and the explorer to the operator in the correct order, and the assistant will dry off the mirror if needed, if it is getting fogged up. The assistant will also dry the tooth so it is ready for the local anesthetic and the topical. Then the assistant will transfer a gauze and cotton tip applicator with the local anesthetic on it. Then the assistant is going to transfer the syringe and observe for patients' unusual reactions, making sure that you are bracing the operator's hand while you are transferring the syringe just for extra support so it doesn't get wobbly. Then you are going to properly retrieve the syringe from the operator and recap it using the chasing method or using a stand to put it correctly in there. Now the dental dam is properly placed on the patient's mouth. Now it is time for the cavity preparation. The assistant is going to transfer the mouth mirror to the operator, and the operator is going to retrieve the high-speed handpiece with a straight Fisher crosscut burr in place. The assistant is going to maintain the operating field and thoroughly rinse and dry the preparation. The operator is now going to retrieve the low-speed handpiece with the round burr, while the assistant maintains a clear preparation by using intermediate puffs of air. Now the operator wants a change in burr, so the assistant is going to change the burr to an inverted cone, continuing to use the air. You want to always make sure that the assistant is getting into the patient's mouth first before the operator so that you do not get in the line of vision for the operator's working space. Once the operator is done with the handpieces, you are going to correctly transfer them the appropriate instruments, starting off with the spoon excavator and making sure that you are getting any excess material off of their instrument when needed. Once they are done with the spoon excavator, you are going to hand them the enamel hatchet. And finally, once they are done with the enamel hatchet, you are going to transfer them the margin trimmer, correctly using the distal or mesial margin trimmer depending on the site of your restoration. The assistant is then going to rinse and dry the preparation, making sure that the patient's mouth is free of any debris or any excess material. Now the assistant is going to mix the Di-Cal using one stroke of each and then mixing it with a spatula into a homogeneous mix and ready for the preparation. And then properly handing it to the operator so that the operator can successfully fill in the axial and pulpal walls of the tooth with the liner. Then you're going to take your applicator and dip it into the varnish and hand it to the operator, and again so they can successfully put it where needed in the tooth of the prep. Once the liners and varnishes are placed, the operator is then going to place the pre-assembled retainer and band onto the prep tooth. Once the retainer and band is placed on the tooth, the assistant is then going to take the amalgam capsule and put it into the amalgamator, making sure that it is on 13 seconds for a 2-spill capsule and just pressing start and waiting for it to be done. Once it is done, you're going to take it out of the amalgamator and take it back to your tray. Once it is back on your tray, you're going to open it up and put it into the amalgam well, and if there is a little capsule that falls out, you're just going to take that capsule, put it back into the capsule. Then you will take the amalgam carrier and mix and soften the amalgam, just putting it up against the sides of the walls and just getting the amalgam carrier full of it, but making sure that beforehand you clear out the amalgam carrier of any excess debris or anything left over in there so you have a fresh start. Then the assistant is going to pass the operator the amalgam carrier so they can put the amalgam in the tooth prep. Then they are going to use the smallest condenser first and just condense all the amalgam down, finishing it off with a big condenser. Then the assistant is going to exchange the large condenser for the burnisher just to smoothen out the amalgam. Now the assistant will hand the operator the cotton pliers to remove the Toffel-Meyer retainer and the band as well as the wedge. Now the assistant is going to transfer a Hollenbach to carve the restoration. And as the operator is carving the restoration, the assistant is just going to stay in the cavity prep to keep it clear, to keep any debris away, and just to give moisture as needed. Once all the carving is done, the operator is going to use the mouth mirror and explorer just to make sure everything is where they want it to be and everything is smooth and comfortable, and the assistant is just going to rinse the patient's mouth and give the whole oral cavity a rinse. Then the assistant is going to pass a moist cotton roll to the operator. Now the dental dam is taken off, so the assistant is going to transfer the scissors and forceps to the operator and then will immediately retrieve the HVE and suction to rinse and dry the patient's mouth. After the dental dam is taken off, the operator is going to check the patient's bite using the articulating paper and paper holder. So the patient is just going to bite down multiple times on the paper, and any blue marks left on their teeth will be taken off with a discoid cleoid and fixed up as per needed, and it will be repeated over and over until the bite is exactly where you want it to be. After the occlusion is back to normal and the mouth is fully rinsed, the assistant is going to give post-op instructions, so that will include that they are to stay away from any sticky foods, any hot foods, any cold foods for at least the rest of the day. And those rules are put in place just so that the amalgam has time to set and that nothing irritates it or gives it a reason to come out. And you want to make sure that the patient knows that if they have any concerns or questions to call the office immediately, and we will help them out as soon as we can. Then you want to fill in the services rendered, making sure that you have all of the complete information and all of the complete dosages that you used on the patient for further notice for any time that they may come in afterwards, and also filling in the chart and indicating what you have done in this procedure so that the patient's chart is fully up to date. Then you are going to clean your operatory using the Mercon wipes and the Mercon products. So you are going to use the Mercon wipes to clean off any of the debris from the equipment used. You are also going to give the trays a quick wipe just to ensure that any pieces of amalgam are wiped away and that they don't harden. Then you are going to put your amalgam capsule in this Mercon waste container just to make sure that it stays away and separate from anything else and doesn't contaminate anything. Then you are going to clean your lines using the Mercon liquid to ensure that any amalgam in the tubes have been cleaned out and rinsed. After your patient is dismissed, the patient chart is complete. Then you will want to prepare your operatory for the next patient so it is all ready to go.